Welcome to Moments with Marianne. This is your host, Marianne Pastana. And we're here today with special guest, Dr. Robert Zorowitz from Humana, who's here to share with us why primary care is the key to better health for older adults. As we age, our health needs evolve, from physical health to mental well-being. However, recent data shows that older adults have a good relationship with their primary care physicians. Particularly, those who practice in value-based care settings may see a significant difference in navigating these challenges and quality of life. In what ways specifically? Dr. Zorowitz is here to share with us just that. So Dr. Robert Zorowitz is an expert in geriatric medicine, has long been a champion of high-value clinical care for America's aging population. Currently Regional Vice President, Health Services for Humana, Dr. Zorowitz helps Medicare beneficiaries navigate the healthcare journey. So welcome to the show, Dr. Robert Zorowitz.
Thanks. Great to be here.
My goodness, what an honor it is to have you here and just to talk about healthcare. I mean, primary care is such a big deal. So can you start by explaining why it's so important for older adults?
Sure. Older adults experience significant changes in medical health, social health, and physical function, as well as mental health. And keeping up with regular primary care appointments is really important to maintain prevention and health maintenance to lead to healthy, better aging.
So with that in mind, are there some specific benefits seniors can expect from regular primary care visits?
Absolutely. Primary care provides regular checkups, preventive screenings, management of chronic conditions, but also a physician that you can trust and knows you and helps you with better aging and better health.
Yeah, just better health across the board. So how can older adults and their families kind of navigate the challenges of finding the right primary care physician?
Generally speaking, for anybody with insurance, if you look on the back of your card, you'll find a number to call, and the company can usually identify a primary care physician that's in network. For Humana members, that's definitely on the back of the card, or you can look at your website of the insurance company, which for Humana would be humana.com.
Well, it makes it really easy. Everything's right there. so,
Absolutely, yes.
so, what are some of the key screenings and services you recommend for patients, particularly those that are over the age of 65?
Well, preventive care is really critical to staying healthy longer, and preventive services can include everything from vaccinations, lifestyle changes such as diet, exercise, and screening for common diseases like diabetes, high blood pressure, cardiovascular disease. And the great thing about Medicare and Medicare Advantage plans is that these are often part of the coverage of the plan.
So, are there any misconceptions when it comes to preventative care and the screening for patients regarding testing and just what's available for them?
Well, I would say there are really not that many misconceptions, except that some people think that as you get older, it's not necessary, but it becomes more necessary because as we age, we get more complex, and it becomes much more important to have a primary care physician who really understands and knows your health and your specific issues.
Yeah, so, it's important to really develop that relationship with our primary care physician.
It's really all about that relationship and trust. That is key.
So, let's talk about value based care. How does it differ from traditional fee for service care, and why is it beneficial for older adults?
Well, traditional fee-for-service care is exactly as it sounds. You have a visit, it's paid for, and the physician gets paid by the volume of visits. But value-based care, the physician is paid by the quality of care. And that really means spending more time with the patient, really getting a better understanding of what matters most to the patient, understanding issues surrounding mobility, mental health, medications, and that's time consuming. However, in the end, spending more time really leads to better outcomes, better health, fewer hospitalizations and emergency visits. So value-based care is really a game changer compared to fee-for-service.
I was so surprised by the study that was done that talks about value-based care and just how many times seniors will actually use it for primary care visits.
Yes, it really does make a difference because having a primary care provider who is willing to spend more time really means that in the long run, health is going to be better. And having that confidence in having a primary care provider that knows you really leads to better care and healthier life.
It's because they need that screening, that early preventative screening so that they can rule out or catch things early?
Yes, preventive screening, of course, but also to have someone who already knows you if things go wrong, you're not feeling well, and you don't have to start from scratch with somebody because you already have that trust and relationship built.
That's such an important piece. Well, and it's interesting because a lot of times people don't consider how important their primary care physician is, but being able to also use the value based system, it seems that people are just feeling that they're more able to go see their doctor without a bunch of red tape.
That's true. And generally in value-based care, not only do you get a doctor, but you get a team. You may get care managers, you may get nurse practitioners. So it's not just necessarily a single person, but a team helping to provide that care.
So it's important for seniors just to maintain regular visits with their primary care physician.
Absolutely, because that's really the way to maintain that trust and relationship and know that you have someone that you can rely on for both prevention and for ongoing maintenance.
So, for those who are looking to maybe either switch or to find their primary care doctor, how do they go about finding one?
Usually, if you look at the back of your insurance card, there will be a number to call, and there will be someone that can guide you as to who the primary care physicians are in network. For Humana members, that's certainly the case. And there's usually a website that insurance companies have that may also be used to search for primary care physicians in the general proximity and in network. For Humana members, that would be humana.com.
Now, does value based care address health disparities?
Oh yeah, social context, health disparities have really come into the fore as important determinants of health, and that's become increasingly important. And again, that's an important part of having that primary care relationship who understands not only medications and mental health, but also the social context. Where do you live? What resources are available? So this is really part and parcel of good primary care.
I love how this all comes together, dovetails so nicely together. So, how do primary care physicians collaborate, let's say, with specialists to ensure that the patient care is going smoothly?
That's a really great question because with value-based care, the physician and the team will have the time and the inclination to coordinate not only with specialists, but there may be other agencies and organizations that are really key to providing services and care. And coordinating all of that is time consuming. But one of the advantages to value-based care is that that's really included as part of that package. And I think there's a great advantage to that over general fee-for-service care, which relies more on volume and frequency rather than the quality of individual visits.
I would think it's an important thing to have that team in place. So if one doctor gives you one prescription, the other doctor knows what that is and it's part of what's happening.
We call that polymedicine. And we know that as we get older, sometimes we're prescribed multiple medications from different doctors, and having one person who can really coordinate and understand what's necessary, what's not necessary, again, that's really an important part of primary care.
Well, Dr. Zorowitz, where can our listeners go to learn more about Humana?
Humana has a website, humana.com, very easy, and that generally will have all the information that one would need.
Well, thank you so much for taking the time to be on the show with us here today.
My pleasure. Happy to be here.
Well, thank you, Dr. Zorowitz. It's been such an honor to spend this time with you and to talk about Humana and why primary care is the key to better health for older adults. Again, if you'd like to connect with Humana, you can at their website, humana.com. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.